For a calm factual entry, when I talk about things like psychiatric terrorism, it's a term that's referring to a network of people educated and experienced with the systematic dysfunction that they arrange. The clear examples of it are service providers. They are in employment positions for these agencies that are getting funding through Health and Human Services. So they're filing whatever they file to Department of Health and Human Services, and then these service providers are given the funding to take direction for the care of these people. So people that have an impairment of some kind, they have some type of vulnerability where they require assistance, this provides the demand of service providers. They are helping provide services to citizens that are medically incapable of getting the services on their own. The service provider positions then have a subcategory of caretakers. So people with head injuries in New Hampshire can get traumatic brain injury funding and self-care services if they have a condition like mine where, yeah, I got a head injury and yes, partial paralysis and some partial blindness, so I need help with administration and transportation as I'm focusing on physical recovery. So service providers to provide transportation and administration have used the administration end of it and the vulnerability thereof, lied to the courts, yet have been filing using the medical vulnerability and the medical condition to get ample funding for self-care services. Meanwhile, Lynn Howard, my blood mother, hiding the conservator position, made bank accounts in my name as Roger LeComte when the Guardian, and I was in the hospital, had probate court told that I was normal and fine. So now they got to arrange where there's service providers, according to the records, that are trying to help me. I'm getting directed services, the funding, to bank accounts in my name, and I'm paying people to help me. But I'm just choosing to not go about life the right way. And so I'm facing consequences. All the while, you've got HUD Property telling Manchester Court that I'm not disabled at all. And they got me to sign something agreeing that I was retired by choice at 47 years old and not disabled, to cover all the people that had been stealing the disability income since the injury using the bank accounts they made in my name. And all of this is the conclusion after getting to Department of Health and Human Services and finding out that I've been getting funding for everything. All the while, MDS was telling me through email that I didn't get disability income because I didn't qualify. And I had to be more patient for self-directed services because they had filed for it and it was a process going to take time. All they've done is maintain that psychiatric terrorism format of administrative rope-a-dope, is what I call it. They keep telling you that it's filings this and filings that, and you've got to call this and file that. And they just do the liability shuffle and keep you chasing, keep you running, and wear you down till you give up or you get frustrated. Then they can play the victim if you drop the F-bomb because they're being assholes. So that's the approach they take with the administrative rope-a-dope on the psychiatric terrorism format. All of it, again, is information that I'm learning about years I'll never remember, and I'm concluding it from the documents that they filed and the email record that I've been able to retrieve of how it's been a non-stop psychological assault by all the people involved that were tax funded to help. They attacked and assisted my blood parents with the theft of Peterborough property, 67 Summer Street, insurance settlements from my injury, insurance settlements from neglect of MDS. The format of this attack for the multi-million-dollar assault by my blood parents in Peterborough residents employed by the state, all of them using MDS as the contact point to file. That's like the fulcrum that allows them to file to Department of Health and Human Services and just keep claiming that I'm a traumatic brain injury survivor, I'm confused, and they just keep using that format. But they file the information in different ways so that no matter who I contact, I'm denied because I'm already getting it and I just don't remember, as the people are stealing everything, claiming that it's me not taking care of myself properly and they're trying to help. So that's like the psychiatric terrorism format is the methodology of systematic dysfunction that they arrange, and it begins with medical fraud while the patient of a hospital to manipulate the courts, and now you've got law enforcement following court rulings they're coordinating that are protecting their attacking instead of the person under attack. So it's a form of terrorism that my parents, Roger LeComte and Lynn Howard, have shown that they're entwined with through Monadnock Developmental Services operating out of Peterborough. And the contact was Tim Donovan with Robin Hill Farm, his company, and he was the traumatic brain injury contractor that showed them how to. And then his people that work with him through sobriety centers like Jolene Rodgers, that woman Wendy Coach, and whoever else. The people that helped him manipulate my impairment after hospital release all showed who they were with the footage from my house and the years of my attempted communication since, and them ignoring it entirely while continuing their public show of a microcosm of corruption, which is a display of political science. It's like social political science that they're showing in southern New Hampshire using Department of Health and Human Services in collectively targeting medically vulnerable people and manipulating the courts to weaponize law enforcement as they rob the banks. It's really unbelievable. So with today, this entry, I am getting through it without doing any swearing. I'm not going to swear. I'm just in that much overwhelming shock daily that the rant that I just went on is not a rant at all. It's factual conclusions that I've come to by endless investigative journalism of my own. Years of research and a handful of friends that authentically helped. The stability that they've been attacking and preventing, it's been to prevent physical recovery and prevent the ability to come to this conclusion. And they just keep attacking. So they keep documenting the way that they're attempting to impose instability, being the number one priority for traumatic brain injury recovery, which continues to show that they're attempting to prevent the recovery, which shows, again, the RSA 131.9, the Chapter 9 felony that Roger committed was when he was guardian, he was planning on stealing everything and preventing recovery. They keep proving that there is a network that is the reason why Roger was motivated to attack, because the network that Tim had shown him was going to protect the attack and keep him and Lynn immune, and Tim's soldiers in Peterborough all immune because they're employed by the state with this approach of judicial misuse by means of medical fraud. And Tim knew because of traumatic brain injury experience for decades. And that's why Roger, Lynn, and Tim joined up and chose to do this. So as awful as the story is, part of my conclusion on my entry today is, yes, it brings the evidence that my parents are awful people, horribly evil people, and there's evil people operating in Peterborough with them. But the most important part of the entry is that service providers, employees of the state of New Hampshire, are the reason why Roger, Lynn, and Tim operate like this. HUD property, it's the reason why people operate like this. So our tax-funded and trusted sources are coordinating and protecting people that are being volatile to patients of hospitals, even their own children, for the love of money. And so that's the real problem, is that our tax-funded and trusted are permitting this and promoting this. And that's why it's happening.